Just to give you a little overview of how we've been planning, um, we created a reopening task force or a reopening leadership task force, which consists of me and also our assistant superintendents for instruction, our superintendent for student services and special education, our chief operations officer, our information services assistant superintendent and human resources, and also our chief financial officer and our communications coordinator. So that's the leadership team that's been pulling in data, working with documents that the county has provided on all the different ways that we should be preparing. And that's what they've been doing over the last couple of months. And we've been working very closely with the County Office of Education and the Department of Public Health, which is going to pay off in the next week or so as we start to narrow our preparations on the guidance that they're providing for us. And really, all those people that I just mentioned are focusing in three different areas: health and safety, or health and wellness, operations, and teaching and learning. And they also prepared for the possibilities of in-person instruction, distance learning, and potential hybrid models, with the possibility of choice for families. And on Thursday, one of the things that we talked about and emphasized is moving forward, our goals are to have our decisions guided by some guiding principles. And they are, of course, safety. We want staff and students to be safe, and families. We want to focus on high quality instruction, the highest possible quality instruction. That's always a focus in Sunnyvale. We want to focus on flexibility, so that as we move in and out of different circumstances or plans, and so that individuals with different health conditions will have different options. And our district is deeply committed to the concept of equity, knowing that providing the same program for every single student isn't necessarily equitable, because different students and families have different needs. So those are those are our guiding principles as we've been moving forward. Okay, so in the areas of health and wellness, I'm not necessarily going to read every single word here, but that's one of the main areas we've been focusing on. We've been working a lot on collecting personal protective equipment, learning about PPE. You see, I never heard of the term sneeze guard before until I had the last couple of months. Sneeze guards are basically what you see if you go to the grocery store that protects you from the checker. And so we're accumulating that to protect our staff and also to protect the public that interact with our staff. I think we did a really good job with devices in the spring, certainly compared to other districts, and we're kind of analyzing how we did there, making sure that we have all the tools that are necessary to the extent that we're going to need to do distance learning. Our nurses are working really carefully to make sure that they understand the latest protocols, or the most important effective protocols for health screenings, whether it's temperature checks or when to do temperature checks. I can tell you that the guidance we've been receiving is that it probably won't be necessary for every student, or useful for every student, to have a temperature check every day. But we will go through protocols with students as they, according to the county guidelines, to make sure everyone's safe, not just for students, but for staff as well. We're focusing on social emotional learning and counseling, because we know this has been a very challenging and even traumatic time for many of our families. And so we're very fortunate, because we have a large commitment to social emotional learning and wellness. And we have good staff in place, a good number of staff in place to really address those needs as we enter into school in August. We're looking at different specialized masks and face shields, and we're getting guidance. You know, this is one of those things that's changed over the weeks, or the last several weeks, about like what's appropriate, what's most effective to protect staff and to protect students from staff. And so we're accumulating that, and then some masks and face shields will be different for staff who are providing one-on-one types of services with students. And then of course our social workers are just critical to us as we plan for any type of crisis intervention that might happen. In the area of operations, one of the big tasks that Rob Smiley, our Chief Operations Officer, and his team have put together is an analysis of all of our classroom space. You know, at one point there was thinking of, you know, every classroom could only have 10 kids at a time. Then it kind of shifted that the thinking might be 12 at a time. The latest thinking I can tell you, and I don't know what the county is going to come up with finally tomorrow, but the thinking now is that there's a focus on having stable cohorts in classrooms as opposed to numbers of students in classrooms. And they've changed based on information from the American Pediatric Association that now maybe distance can be 3 to 6 feet as opposed to a hard 6 feet. So all those analysis are going into determining like what's the appropriate amount of classroom space that we need to accommodate our students. The second bullet there talks about cohort stability, which is everything that we're hearing now. So we have to think about how we can keep classes together and not intermingling with other classes, which is really hard when you think about young people. But that, everything we're hearing is that that's going to be the key to us being able to reopen safely and successfully. We have explored and are exploring childcare options for our employees. You know, many of our employees have kids of their own, and if those kids are not in school every day, then it's hard for them to come to work every day, and then the whole thing becomes very challenging. So we are exploring childcare options for our staff, which will allow them to come to work every day. And of course, we have to think about like what will happen if we open up and then we have to close again and go in and out of in-person teaching to distance learning throughout the year. That's a very real possibility, even by the school site. And one of the things that we're waiting for this week will be the protocols for how we are expected to respond if there's a positive case, either with a staff member or a student. How long does either a classroom or a school need to be closed in order to investigate that before we can open back up? And so that might lead to a temporary implementation of distance learning after in-person learning. So those are factors that we're considering. School lunch is actually a huge consideration. How can we keep our kids safe as we have large numbers of kids moving through cafeterias and eating? We're pretty confident that we just don't think we have the cleaning crew for kids to eat in their classrooms. And so we're going to have to come up with some scheduling of lunch. And then also consider if kids are getting distance learning, how can we make sure that they're getting the nutrition that they need as well? And something where I'm really proud of Rob Smiley, Chief Operations Officer, and his team is they proactively have gone out and sourced air filters that are really hospital grade, that are intended to, the same filters that a hospital would use, that would filter out bacteria and virus. So with circulating air or air coming, we're really going to be in a good position there. None of these things are 100% effective, but that's the kind of thing that's going to make a significant difference, I think, on the margins. And in terms of teaching and learning, of course, is really the heart of what we do. Our summer professional development is being developed by Dr. Tasha Dean and by Mala Ahuja and their teams, really focusing on technology tools, SEL, literacy, and math to provide the best possible instructional program that we can. One thing that we heard loud and clear through all the surveys, whether it was from students or parents or even staff, was we need to move to more consistency of expectation among teachers, grade levels, and school sites. And if you remember how we went into distance learning in the spring, it was really based on an emergency. And then now as we're opening up, and the state of California is, in their legislation, is saying that we need to have high expectations. There needs to be high expectations in terms of instructional minutes and days of instruction. We agree with that. So parents, you can expect us to be returning to the high levels of expectation and consistency that you've come to know. But in some cases, it will be with distance learning, so that will be challenging. Although I have to say, I am immensely proud of our teachers for the hard work that they've done in adapting their practice and learning their practice in just a few short months to where they're doing an outstanding job providing distance learning. And they will be able to do that to the extent where that is necessary as we enter the school year. You can see there the first 2 weeks will be building classroom community, all the things that you would want to do at the beginning of the school year, with also, to the extent that we can get kids in the classroom, to establish online learning norms and setting expectations so that should we have to return to distance learning, our kids and our teachers and our classes will be ready for that. I think you can read some of the other bullets here. You know, we refer to, we're going to be paying attention to the social emotional needs of our kids. We're going to be, again, we have a strong team that's able to accept referrals, do assessments, and support families and individual kids. Our students with special education will really be a focus because to meet their IEP goals, it's learning through distance learning is really, really challenging. And so to the extent possible, we'll have them doing in-person teaching and learning. And one thing that we've heard over and over from parents is to provide parents with information and training so that they can assist their students with tech tools across all the different sites. And then another comment that's not listed in this bullet that I thought was really important from the advisory team that we've assembled was for teachers and staff to prepare their students for when they go back to school for in-person instruction, to prepare students for why it looks different and how it's different, and so that they can be prepared for a different type of environment when they come back from when they left. So just, if you look at the survey highlights of the staff survey and the student and family surveys, you can see when you lay them out this way, there really is a lot of consistency. While our staff did a phenomenal job ramping up with distance learning, it's challenging, and it's challenging to teach from home. It's challenging for our staff to have a work-life balance, and it's also challenging for our families to support their kids' learning at home with the technology or just with all the other challenges that are going on in homes when parents are online with their own work and their kids are online. So that's challenging. This is telling us that we really need to focus on getting kids back to school, and the legislation recently passed at the state level emphasizes just that the emphasis is going to be to get kids back to school with, as I mentioned, the strong instructional program that districts, and in our case, our district, has provided in the past. So that's going to be the focus. I think we can anticipate that in the guidance from the county that's coming up this week. We need to focus on equitability to make sure that we're reaching all of our students with the best distance learning practices of our staff. It's just not the same as being able to walk up to a student and provide assistance to them. Even though our staff has done a fantastic job of reaching out to those kids who've been missing or we haven't been able to reach because they're helping their younger siblings with teaching and learning, or they're in a different environment, or they're living in a circumstance that just doesn't allow for lots of people to be on computer and focused at the same time. So that's really been a focus, and should, to the extent we need to go back to distance learning, we'll be ready to do the best we can to support all of our students, knowing all the different environments that they're working in. And then this is the survey data that kind of supports what I just said about families and their desire to return to in-person instruction. While that is the clear outcome of this, it's not the outcome for everyone. And I think that it's a very valid concern that some families would have about not returning to in-person instruction. So that's why we're, to the extent that the state and the county allows, we'd really like there to be options for families that for whatever reason just are not able to, for health reasons or whatever, that are not able to come to school to participate in in-person learning. So we envision having perhaps two programs, one that would be in person and one that would be distance learning. And again, we don't have all the details of that right now because we're awaiting the county guidance. So here's a timeline moving forward. As you can see, some things are happening really quickly. So June 30th, by June 30th, we expect to have concrete direction from the county that we can start to build our plans. So all the different pieces that we've been working on, we can then say, okay, these are the ones that we're gonna pull and form together to be the Sunnyvale plan for returning. The Reopening Advisory Committee, that's what RAC stands for, will meet July 2nd, which is this Thursday. And this will be the third meeting of that group. We'll have a lot of information to share with them at that point. And we'll be getting more feedback and data from them. They're a very representative group of about 30 people. All the 10 schools in our district are represented, all the different grade levels. So that's one of the forms of, along with this forum and the survey, the Reopening Advisory Committee is giving us more data to help us put together our plans. By July 8th, there's a board meeting on July 8th. The board will meet and the Reopening Leadership Task Force will make a final proposal to the Board of Education. And the board will look at that for consideration and discussion. And then by mid-July, we haven't set the actual date, but the goal is by mid-July to come to a final decision and to begin communicating to the community what our final decision of the structure of returning is. And then back to school is scheduled for August 19th. At this point, there's no change in that date. And I hesitate to say this, but there's been some talk about the possibility of like, well, if we used some of the days at the beginning of the year for more professional development teachers and maybe traded out some of the other staff development days and have those be instruction days, is that something that we could do? So there might be some flexibility a little bit on that, but as of now, the opening day is scheduled for August 19th. It certainly won't be any earlier than that. And with that, that's a lot of me talking. Now what we really want to do is hear from you and what your questions are, what your experiences are. I really focus on the experiences. We want to hear what you've experienced with distance learning so far and how that informs what you're hoping for as we move forward. But this is really your forum, and we have a number of district staff here who can answer questions as best we can based on the information we have so far. So Aaliyah, are you going to be coordinating the?
Yeah, so if now you want to take the time to go ahead and use the raise your hand feature of Zoom, it pops up in order as received, so I'll just go ahead and start from the top and work my way down. So we'll give you another minute, but we can go ahead. Shall we get started? Jesse Weinstock is first.
Hello and good evening. My name is Jesse Weinstock, and I'm a science and social studies teacher, as well as one of the SEA union site reps at Columbia Middle School. To the board members in attendance, thank you for hosting this community forum and for granting us the opportunity to share input on what is without a doubt the most complex and impactful challenge I personally have ever had a direct voice in overcoming. As was expressed in Thursday's meeting, and what is clearly understood by anyone following the statistics surrounding COVID-19, lives are unquestionably at stake here, and how the board agrees to proceed regarding how school will function in the fall will undoubtedly impact these statistics. which represent the lives of our students, families, staff, and greater community. I wish to begin by addressing a mistake which I, along with many others, made during last Thursday's community forum. While this mistake might appear to exist only in language, I assure you the impact of this mistake reaches far beyond words. I'm referring to the mistake I made repeatedly last Thursday in front of the board and in front of all in attendance that took place, all in attendance when I referred to teaching and learning that took place within our district and around the country between March 16th and early June as distance learning. It is objectively incorrect to refer to teaching and learning that occurred after school abruptly closed on March 13th as distance learning. Furthermore, by continuing now to use this incorrect term to describe this period in schooling back then, only further impedes our community's ability to appropriately respond to the challenge that brings us all here today, choosing how school will function in the fall. Please allow me to explain. Anyone who has ever participated in a true distance learning program can verify that structures, assignments, due dates, and the like were outlined clearly at the onset of said learning experience. In a true distance learning model, participants can look ahead and have confidence about what is expected of them and how to proceed accordingly. Does that sound like the schooling we experienced between March 16th and June 12th? I understand and appreciate why our community repeatedly made this verbal error while we all progressed through this experience together. Socially and emotionally, this was a wise choice. Considering all the newness and uncertainty in our lives during that time, waking up to participate in distance learning offers far more peace of mind than waking up for a day of crisis learning. Being an active and innovative advocate for social and emotional well-being within and without our district, I am present to the great need of access to peace of mind anywhere we can find it, especially any peace of mind that can be accessed through words we choose to share with one another. However, now that this school year is over and we are tasked with creating how next school year will function, it is irresponsible and frankly manipulative to continue to refer to the end of last school year as distance learning. By doing so, we limit our own individual and collective perceptions of how, as Michelle Maginot wisely mentioned last Thursday, we can reimagine schooling. We must not conflate the crisis learning experience we all shared at the end of last school year with our vision of what true distance learning might look like in the fall. I understand that the burdens of any distance learning model the board might create and implement in fall will be inconvenient, challenging, and even life-changing for our community. However, advocating for an in-school teaching model for fall because one anticipates the same mistakes we encountered during crisis learning will continue into our prospective distance learning model in the fall will ultimately mean more than inconvenience and challenge for our community. If we choose to employ an in-class model for fall, community members will get sick, community members will spread their sickness, and community members will die. I am not suggesting distance learning in the fall will be perfect. I'm not even suggesting it will work well for everyone. I am, however, here to remind you that countless teachers, including myself, have willingly agreed and are actively giving up substantial portions of their invaluable summer break to continue innovating, modifying, adapting, and troubleshooting our current curriculum based on the mistakes we learned from crisis learning last school year. With a resilient spirit, a lens of growth mindset, and all the grit I can muster, I implore you all to stand with me in advocating for at least the guaranteed option of distance learning for all staff and students next school year. Thank you for your time.
Thank you, Jesse. So the next person up is Jay.
Hi, can you hear me?
Yes.
Hey, quick question. Do charter schools will charter schools follow the similar guidelines as set forth by the school district?
I expect that they would have to follow the same guidelines because the guidelines are coming from the county office and from the county Department of Public Health. So they'll have to follow whatever guidelines that those two agencies come up with.
Thank you.
The next person is, I apologize, Quinn.
It looks like Jay is still the one unmuted. Oh, Quinn is gone.
There she is. She became a,
Hello.
hello.
Hi. So I'm Quinn Fitting. I had a daughter in Mrs. Smith's class TK. Wonderful teacher. Thank you so much, Ms. Smith, for just adjusting to the crisis learning. I think I agree with the first speaker who said lives are at stake, especially the teachers and the community workers. I know that there's probably other factors that you guys have to decide on reopening the school, but I really think that for the younger kids, TK and kindergarten and upper levels, if long distance learning, I don't know what you call it, but crisis learning is very important. I think with reopening schools, people would get more sick, and it's just not good for anybody. So please consider getting more, getting better and better at the distance learning so that we can all stay healthy. Thank you so much.
Thank you very much. The next person is Katie Rowland.
Hi, everyone. It's good to see you all. I'm at San Miguel with my daughter who's in the first grade, and we also had a wonderful teacher, Ms. Giarella, who guided us through a really hard time, did some pretty incredible work, so I want to acknowledge her. I had two things I wanted to make sure to share with you all, and thank you for this opportunity to do so. First of all, I noticed in the survey results, 92% of the families are not families who are relying on the district for food support. If we think about that in terms of the representation of our district, it leaves me wondering where their voice is in all of this. So I know you have your panel, and I know from working with some of you personally that you are deeply committed to this, but I think it might be a benefit if the community could hear more specifically the ways in which you are making sure that all voices, including historically marginalized voices, are being heard. And the second thing that I would like to hear about, and I was really excited to hear you mention earlier, that you're reading what's coming out of the American Academy of Pediatrics. One of the things that came out to me in that report is that they really are looking at trade-offs. So the idea that, yes, sometimes we could do everything possible to keep things safe, but sometimes those things aren't developmentally appropriate, and sometimes they may not provide enough risk reduction to justify the potential harm. So I'd like to hear your thought on that idea of trade-offs. They mentioned specifically play with early elementary school students and classroom and classmate interactions. Thank you all.
I don't know if Tasha and or Mala would like to respond to that. I mean, I could just kind of say generally that, yeah, reading that, I read that report this morning, and you characterized it really well about the appropriate trade-offs, which is a really difficult concept to wrap your head around when you're thinking about illness. But we do know that play and social interaction are also immensely important for children and developmentally. So, I think if we withhold that from them for a couple months, like we did from March to June, that's really unfortunate. How long would it be appropriate to withhold that from kids? It seems like there's a limit to that. So I don't know if Tasha and or Mala would like to jump in and talk about that.
Yeah, I would say we don't have any definitives on this, but that's why information from a health department is so appropriate and important. That's why we're also looking at multiple modalities of instruction and learning environments and assessing, some students have capacity that some students may not have. So we're not just looking at students as students generally, but we're also taking into consideration who our students are uniquely and individually, and also their developmental levels as we go through this process. So we definitely hear the concepts that have been mentioned, and those are definitely the things that we're thinking about as we're thinking about instruction and as we're thinking about the health and safety of students.
Thank you, Tasha. The next person is Marguerite Galvin.
Hi, everybody. Thank you. I didn't make the last meeting. I was not able to get in. I had a couple of things come up, and I just wanted to bring them up to your attention. A couple of teachers that I know of have health concerns. One is pending a doctor's visit this week, and they're really concerned about being exposed because, you know, obviously elementary school, they're going to get exposure from the children. We don't know if the children have anything, but it's just the fact that they're fearful about their health. So how does that work? I mean, how do you weigh the odds, you know, the differences between, it's important to teach the children, but then if the teacher is compromised, how does that affect the teaching? And, you know, for them, and they also have children, one of them does, and they're thinking, well, maybe I'll just take a year off. There's a lot of things happening where they might change grades if they can, and I think it's very difficult for everybody to make these decisions, especially if some parents that are young parents have children at home and they bring it home to their kids if they're at school at some point. You never know. And then how does that work? Does it start to snowball, or if one person eventually finds out they have it, 2 weeks later, everybody at the whole school is quarantined for 2 weeks? I mean, I don't know. You know, so these decisions are pretty heavy, and I certainly have to hand it to you that handling all of this and all of the feedback that you're getting is quite intense. And I'm thankful that I also was able to work for summer school, and I realized that there's a lot going on. I didn't know the children that I had, and one of the questions you brought up is how to build a relationship with new students. First 2 days is hard, even if you're meeting the kids. But I've been using a couple of apps, which has helped me quite a bit. One is called Insight Timer. It's a SEL meditation in different formats for families as well as for individuals, and you can set it by time and experience, for creativity, for patience, for sadness. Another one is Balance. Another one is Headspace. And I don't use each one every day, but I personally, as a teacher, have benefited from it. And if I'm good and I share it with them and then they share it with their family in the evening, it's a really good thing because we're staying calm and we're not panicking. So for me, building relationship right away is to set the tone that calm down, try to cope with it, try to look at, you know, focus your mind, and let's talk about learning. And that's how I've gotten through the virtual learning this summer. And I think I have not really met my kids in person, but I think that if I do make a mark, it would probably be having them stay calm and be able to handle things on their own and have tools that they can use to handle it.
Marguerite, I really appreciate your comments, and I wanted Jeremy to have a chance to respond to the first half of that, because you had some questions in there about staff with health concerns and coming back to
yeah, and children and things like that.
Yeah, I know he's been thinking about that a lot. So Jeremy, do you want to?
Yeah, so we are kind of approaching this kind of two parts. Or the first is just making sure we understand the condition and how we're opening, and then we've done some surveying of staff regarding potential childcare issues as well as underlying health concerns as defined by the CDC. So that's a long way of saying that we're gonna take how we open first. You know, safety is one of our core values and how we're evaluating that, and then have conversations based on what the county health says is the appropriate safety precautions to take. So I think we're trying to take this one step at a time with what we know, but we do know roughly the proportion of our staff that potentially have underlying health conditions and or childcare issues. And then we're waiting for that additional information to come back regarding the conditions, and we're opening, and then we will follow up with staff members. And again, I want to reiterate, all staff, once we know those working conditions, to assess our workforce readiness.
I have a question. Can I ask a question, or is that not allowed?
You're allowed.
Well, I wasn't sure because of the format. I get confused, you know. So this is also for Jeremy, if it's, or for you, Mike. With the staff, when a staff member is put on, like, let's say a staff member would, are we going to relook at how things go for sick leave for staff? Because when a staff member is put on, like, let's say someone in the teacher may or may not have been exposed to COVID-19 and they're required to quarantine for 2 weeks. And so then, like, they would, if they weren't already crisis or distance learning, depending on where we're at the time, if they were not teaching in person, or if they were teaching in person and they weren't allowed to be with those kids, the children, then normally they would go through their sick time and they would, and then they would have to start paying for a sub or something. Like,
So Bridget, the state and I've amazingly sort of forgotten these details because once the school year ended, but the state and even the federal government through the Families First Coronavirus Relief Act, FFCRA, both provided additional leave for people in the conditions that you're describing. So there are additional protections for employees in those cases. Yeah.
So they wouldn't have to worry about that part of things. That'll all be, it will be slightly different than how it normally is.
It would, well, they have a new layer, a new first layer of protection. You know, like all leave, it isn't, you know, forever. You know,
Right.
But there's a new first layer.
Okay.
And it kind of struck me that some people probably don't know all the people on the panel here. So I'll go around and introduce them. So Mala Ahuja is our Assistant Superintendent for Curriculum Instruction and Assessment. Reed Myers, I'm just gonna go how I'm seeing you on my screen. Reed Myers is one of our school board members. Bridget Watson is another one of our school board members. We would have had more of them here, but because of the Brown Act, we're limited to only having 2 because they are potentially engaging in the discussion. So we have to follow that law. Lori Van Gogh is our Chief Financial Officer. She's in charge of all the money. Dr. Tasha Dean is the Assistant Superintendent for Student Services and Special Education. Aaliyah Wilson is our Communications Coordinator. Jeremy Nishihara is Assistant Superintendent for Human Resources and Student Information Systems. Rob Smiley is our Chief Operations Officer. And Jesus Romero is the Administrative Assistant to the Superintendent. And beginning in just 2 days, I'll be the Superintendent. So, okay, back to the questions and comments.
Okay. Thank you, Marguerite, for your questions and comments. Next person is Chandru Vital.
Oh, hi, can you hear me?
Yes.
All right. So I just want to say thank you for giving me the opportunity to speak. My name is Chandra Vittal Baba. I'm a speech therapist at Vargas Elementary. And while everyone was talking about the reopening plans, I was remembering after one time I had a very difficult, IEP meeting, and Director of Special Education, Linda Van Maurik, was saying, don't worry about it, because we feel confident in you. If we didn't feel confident in you, we wouldn't have hired you. And I was really reflecting on this as well, too, as I want to address the administration, the board, as well as some of the parents who are here as well. What I'm seeing is there's a broad consensus among all staff members of all different types that we are not ready for reopening in this environment of very high increase in cases. And I really request and really implore that the board, the administration, and the parents put their trust into the staff that they trust so much to protect their kids 8 hours of the day, when we say we're not ready. I think we need to have a sustained lowering of cases to even consider reopening, as well as really robust plans as to what will happen when, which I think based on what's happening in other countries, not if, cases will spike again. It is also my dream as well to be back in person serving students in the way that I was trained for. But we were also trained as educators to expect that no 2 days are different. I believe that I'm a much better educator than I was back in March because of how much change and how much challenge that there's been. And if we have and I think if we have a clear, defined plan for virtual learning or other learning that keeps us safe, we will be able to address some and not all, because I think we do endeavor to smooth all the gaps in learning. But I do think that if we have a robust plan, we will be able to address most, if not all, of the equity concerns that we have, as well as providing the same quality of education that one would get in a more traditional format. So that is mainly what I would say. Please trust in us when we say that we do not feel ready. We're very nervous. I personally am very nervous about the risk of infection, because I think it has been shown that it never has been a disease that only affects quote unquote old people. People who are traditionally or who are previously relatively healthy, people of all age groups are being affected, including children. That is what I want to say. I just want and thank you for your time. I would like to yield the rest of my time.
Thank you, Chandru. Next up is Samanyu Goyal.
Hi. Are you able to hear me, right?
Yes, we can hear you.
Yeah, my only concern is last time the distance learning was good. If we are not going to open the school, if we somehow can improve it. Last time it was just teacher give the assignment and there was no follow-up on that. So somehow if we can make it more interactive and more challenging for student also, and clear goals for the parents also, so parents can help and see the progress of the student also. Third thing I want to add in this, for the social covering, if we can add half an hour early morning or in the evening session for the students, so they can collaborate with each other and also with the teacher on the daily basis, so they can interact with each other, help us a lot. Yeah, that's only from me. Thank you.
Thank you very much. The next person up is Brian Gilstein. Brian, if you could go ahead and unmute yourself, you're good to.
Okay,
There
got
you
it.
go.
All right, hi. I'm Brian Gilstein, speech and language pathologist at Columbia Middle and Sunnyvale resident. I want to thank everyone at the district for their long hours and commitment and concern. I just have a few thoughts to share. Shortly after stay-at-home began, I read about a principal of a high school in Brooklyn. This principal had no preconditions, was otherwise healthy, but died from COVID. Here's what struck me. She was 36 years old. 36 years old and otherwise healthy. COVID is like being bit by a venomous animal. The younger or healthier might have a better chance of surviving, but there are no guarantees, and no one in their right mind would knowingly create the conditions for that bite to happen. For those who survive, there is growing documentation of people never hospitalized who continue to have symptoms and are unable to work for months, not just weeks, who have quote unquote recovered with potentially lifelong debilitations. Look around at the conditions in our country, our state, and our local growth of cases. All are worse than when we first shut the campuses. Medical experts assume an even greater danger come the fall. And so it flabbergasts me that these conversations do not start with the assumption of distance learning until conditions improve, that we might knowingly put our community at risk. To close, I want everyone listening to remember that 36-year-old principle. If we open the schools prematurely, and that happens to one of our staff or our students or to their families, if that happens, we knew better and we chose that callous disregard. Thank you.
Thank you, Brian. So just did want to share that we do have a stop time of 7 p.m. To be totally honest, we have a board candidate forum that begins at 7 p.m. So we want to get through everyone, but if everyone could maybe just try to keep their comments to 2 minutes long, that would be fabulous. We do want to hear from all of you. We have 14 hands raised left. So hopefully we can get through all of them. Thank you very much. The next is Deepali Suri. Oh, did we lose Deepali? I think we lost Deepali. We can come back to you if you raise your hand again. The next person is Elsa.
Hi. Can you hear me?
Yes.
Hi. So I have a question. I'm particularly worried about the school my kids go to, obviously, but because it's an immersion program. So how are we immersing if we can't go to school? In my case, I'm fully bilingual, so I can somewhat guide my kids, but I'm in no way prepared to teach them. So I know about a particular parent that told me that if this doesn't go back to immersion, she will pull her kid out of the school. So this worries me to no end because, like her, there must be many parents that can't help their kids. And I am worried about the program. I am worried about how is this going to work out. So can you, have you looked at programs of choice and made a decision? How's it going to work out? Are we going to have Zoom meetings all day with the kids? How are we going to immerse the kids if they can't go to school? I'm worried about that mostly. So if you could please give me like some answer of what's going to happen for this kind of program. I think it's the only immersion program. So if you could please give us like somewhat, if you have plans specific for San Miguel. Thank you. I wait for your answer.
Yes, I'm going to just chime in to say thank you for sharing your concern, and that definitely is something that we've been, that's been brought to our attention. The concern about students that are especially not from Spanish-speaking families that are in the immersion program. And as we're putting our plans together, Dr. Dean we talked about special education students. Special populations is really the group that we're considering most as we lay our plans out. And the Juntos Dual Immersion Program is definitely one of those special populations that we're going to pay close attention to as we share our plans for consideration next week.
Thank you for that question, Elsa. The next person is Devesh Ranjan Sinha.
Yeah, hi. I'm audible?
Yes.
Yeah. Thanks for giving us this opportunity, and congratulations, Mike. Yeah, so I have a question as so the first day of school is going to be probably the 19th August. So as in parents, should we have options to select whether we should send our kids to school or not? This is my question.
Yeah, that's our hope, is that we can put together an option for parents to provide in-person instruction or distance learning. The state guidelines, as I read them, as I understand others interpreting them, are suggesting that we need to provide in-person instruction for students to the greatest extent possible. So I expect that will be, unless, and things can change. We all know that things have been changing every few weeks, but things can certainly change. But That's the expectation that the state is placing on school districts at this point.
The next person with their hand raised is Vivek.
Hi, can you guys hear me?
Yes.
Okay, so my name is Vivek and my daughter is in Ellis. And I understand that remote learning is not a clear substitute for the in-person learning, but when I speak to our peers across this district and even other districts, there's a lot of disparity in not just students' ability to learn, but also teachers' ability to provide a comprehensive experience. So our teachers have tried hard, no doubt, and we are very thankful for that. But it's been a, somewhat disappointing experience for some of us that have seen some teachers not providing enough video explanations, not enough live classes, very sporadic parents engagement. I mean, sometimes first explanation of expectations and the only explanation came 3 weeks after the remote learning had begun in a Zoom call with parents. So I just feel the organizational ability of teachers are really different from teacher to teacher, and it can be definitely more consistent. So what are some of the steps the district is taking? Maybe it's a question for Mala or Rob or whoever, in providing more training to teachers for remote learning so we have a consistent experience and a much more fuller experience as possible within the remote learning limits. And I guess this is still here to stay because you never know, with flares up and flare down, we could go in and out of this model. So what are some of the steps that you guys are taking to train teachers?
So I can address this and go back to Dr. Gallagher's introductory presentation, when the slide on teaching and learning, that was one of our very firmly identified criteria, is that we do need to have consistency. And I'm going to quote what Jesse said, our first teacher, who talked about the crisis learning as opposed to distance learning. And in the professional development that we've put in place, we have a group of 25 teachers that are working on the apps that we've narrowed down for use. They're using it through summer, so we are vetting the process, field testing it. In August, we have 2 weeks of professional development already planned, and we have sessions that are full and overflowing with teachers that are joining in to learn about all these tools. Our teachers are really doing all they can. And in any situation, we know as human beings, we have different strengths we bring to different situations, different personal issues that we deal with, but we definitely hear the family's perspective about consistency. And teachers want it too. Believe me, teachers want the consistency. They don't want to be compared against each other, and they're working and in collaborative groups and teams at the school side and across the district in grade level collaboration to have that alignment.
Thank you, Mala, and thank you, Vivek. The next speaker is Tracy.
Hey, how's it going? I'm speaking on behalf of Tracy. I'm her husband. So we have a quick question. So I'm just wondering, going to next year, is school district plan to reshuffle students into different classes as this year? Because if we continue distant learning, we feel it's best to keep the same group of kids together from last year. At least they have face-to-face interactions from last year. If you reshuffle the classes and they have to meet new set of kids, it might not work best for them. We just try to get some inputs from you guys and see what's the take on that.
I guess I could take that. That's certainly an option. I think part of those variables would be how many students are actually returning to us. That's something we're trying to assess right now with registration. And so we'd want to make sure that the numbers kind of balance out, but I guess that's definitely an option. And I guess hopefully it's something that we could try to kind of take into consideration, but it depends on what information we get about the condition that we're opening, if it's in person or remote, that we'd want to keep those cohorts together. So.
Thank you, Jeremy. Next up is Veronica Galvin.
Hi, can you hear me?
Yes.
Okay. So I just wanted to comment on the fact that I've heard it be said that students in special education are top priority to be sent back to in-class learning. And on this matter, as a special education teacher, I wanted to comment and say, of course, up to this point, we have not been able to meet the students' IEP needs, services, and goals to 100% fidelity. As of even since March, we have continued to write IEPs as if we were providing services in a physical classroom environment. If we truly want to be able to serve our students and provide the supports that they need to succeed in a distance learning environment, we need to write our IEPs in that matter. Quite frankly, not providing this for our students, whether it even includes, like, I understand the need of going back to the classroom, even if it's for short, like 30-minute to 45-minute sessions with one-to-one with strict PPE, physical distancing, and cleaning in between student sessions. However, going back full-time to a full classroom in a special education setting is irresponsible. Frankly, I find it discriminatory, and our students with disabilities, as well as their teachers, deserve just as much of an opportunity for a safe learning environment as other students.
Thank you, Veronica. Next up is Jennifer Slattery.
Can you hear me?
Yes.
Perfect. So I'm Jennifer Slattery. I teach an SDC class at CMS and also our site SDA rep. So I have a few questions that have been brought to my attention by our staff at our site. And I'm just gonna read them off, okay? As long as everybody is okay with that. We feel that maybe clear plastic barriers around the desk, like the sneeze guards that Dr. Gallagher was talking about that they have at restaurants and at stores, would be helpful for our students to have on their desks. And do the facilities already have those air filters installed? Or are they in the process of being installed? Yes, I see some nods. Okay, perfect. Is there the cleaning schedule? Is that put just on the teachers, on the custodians, or do we have a professional service that's gonna come in and clean our classrooms? Is there going to be funding or stipend for transforming our home into an office if we do continue with crisis learning? Because currently right now, I know for myself, I sit at my dining room table, like surrounded by my child's toys and I don't know, my kitchen decor and stuff. It's not necessarily as efficient as my classroom. You guys addressed the 6 days, but did you address the subbing situation? So if we do go back in the classroom and we have to have a sub, is that sub going to be tested and going through the same protocol that a normal teacher would? And then that's another risk to our students being exposed if they have a new person into their classroom. The new grading scale that's changing from a 5 scale to a 4 scale, is there going to be additional time for teachers to like do their rubrics and understand and teaching the students that the rating scale is different? And we collectively feel that there needs to be some sort of accountability for students, which I know is something that we've all addressed. Our PE teacher brought up a device called I think it's called a Whoop, and it tracks, it's like a Fitbit kind of, but it tracks your breathing. And she said that there are some studies that have said that it can show like breathing issues before they're diagnosed with COVID. Would the district provide like COVID testing for all teachers and staff and anybody on campus so we can make sure that there's not an asymptomatic carrier of COVID? The students that did not participate in crisis learning, would those students be expected to come to campus if we come to campus? Because obviously there's some issue if they didn't participate in like the last 3 months of school. And I think that's everything. Thank you.
Thank you, Jennifer.
I just want to, she said there were questions, but I just want to say that many of the areas that you have brought up are areas that are on a list and a task with regards to the teams that Dr. Gallagher mentioned earlier. So I won't go into comments on some of those, but I can say that all of the areas that you have questioned in your response and your questions today are items on our checklist for us to look at and make decisions about when we look to our plan for whatever we're going to be doing.
Yes, thank you.
And I would just let the group know that we've added some more people asking questions, and we're going to try to get to everyone. Questions or comments. I don't think we're going to be able to any more people who raise their hand. We may not get to any more of them to be able to end on time.
The next person is Danita Flores.
Hi there. I want to, can you hear me okay?
Yes, perfectly.
Okay, great. I want to thank you for taking the time and doing this because it makes me feel better. I was having a lot of concern. I did hear somebody mention that there's probably going to be options because I don't know if I would really feel comfortable my kids going back to school. I have a lot of health issues in the household, elderly parents, asthma, diabetes, all that in the house. So, I'm really concerned. And it sounds like you guys are taking all the steps you need to take to make sure that they're looking at everything. With the flu season coming up and the numbers rising, I get very, very scared about sending them back. And seeing those, is there going to be temperature taking, when the kids enter the school during flu season? I see that you guys are probably taking the protocol and getting all the PPE stuff ready for the schools and the classrooms. I work in plastic, so I know it's flying out the door right now. Face shields, coverings, desktops. So seeing if you put all that up, I still am very worried about the numbers going back up and the kids getting sick because that's where they usually bring it home. So you guys are taking, you guys are looking at taking temperatures during the flu season if the numbers do go up, or things going to change?
The latest I heard was that taking the temperature of students is unreliable. But we'll see what the guidance is that comes out, if there's anything different on that. I think it's more reliable with adults. So there may be taking for adults.
Gotcha. Okay, interesting.
There will be a questionnaire like protocol on symptoms, however.
Okay, great. And then I see that you're probably going to be updating us all when the time does get closer, but as long as we have options, because I may pick just keeping the kids at home because I can't take that risk with the people that I do have in the household.
Thank you so much, Danita.
Thank you.
The next.
Sorry, Mike, I have a question really quick. So you just mentioned that about temperatures and temperature checks, and I had only heard something really briefly from Mary Ann Dewan about, and there was like a back and forth about, and she was sharing some information about how a lot of times other symptoms would present first, or that there'd be other indicators. And I think we had that talk on Thursday where I was saying, as a classroom teacher, I definitely remember a kid throwing up in the trash can before I was told that they were sick at all, or you just don't know, and it's non-invasive. There's lots of things, even though it's not the only safeguard. I would just want to have more like data and a discussion about it rather than just saying like, well, now we don't have to. Like, are we going to have the opportunity to like go through some of the precautionary issues if it's like said, well, you could do that, but you don't have to do that. Like, are we as a school district able to?
I don't know. I know that the state guidelines are pretty strict about limiting who, at this point, who can choose not to be in-person instruction.
Well, I'm talking about temperature, just things
Right.
like temperature checks or staggered drop-offs or anything like that.
Is to follow what the county health department says. Like
Mhm.
how much flexibility we have beyond that, like that's something we'll find out.
Okay, thank you.
Next up is Anise Chamarty.
Hi, can you hear me?
Yes.
Hi, how are you all? Thank you so much for taking the time. I really appreciate it. It's really good to hear that, you know, you guys are all working hard to make the right plan for our kids. And I really appreciate all the hard work that the teachers put in so far. Although I do have to say, having a asthmatic son at home, I completely agree with Brian Gilstein and also Veronica, and also the other speaker in front before me. I forgot her name. I do not think that the option of flexible learning should be a questionable item. I think it should be part of our plan, no matter what. Because with all due respect to all the parents who do want to send their kids, there are some of us who don't want to. So I think both the parties have to be given equal importance. And I just have a few suggestions that I'll just go step by step. I don't really have any questions because you guys have done a wonderful job answering almost all of them from other parents. Immersion program. I think given the pandemic, that probably should be optional so that parents who are working full-time do not have the time to you know, go through and help our kids who are not you know, familiar with the language at all. Although I do appreciate and respect the thought and the thought of the immersion program, I think in a normal situation it would be great, but given the pandemic, I think it should be made optional. And secondly, teacher interaction should be every day. My kids look forward to speaking to their teachers. Interaction with their friends should be every day. They should have a recess where they can play, chat, read books. Maybe whatever we do, we should try at least to do it virtually. And teaching from the teacher should just not be restricted to reading. Teachers should be able to do something with science and math too, give them a live instruction. Assignments shouldn't be optional. I think assignments should be graded, should be expected to be turned in. You cannot keep the kids motivated without just telling them that, okay, you know what, you can do this or not. It just doesn't work, at least with my kids. I'm sorry. And finally, again, thanks so much for you know, for all the hard work and everything. I really appreciate it. But just want to end by saying that when your child is gasping for breath, when I have to give him inhaler, it's not a great experience. And I don't want any parent to go through that. So please, please, whatever you have to do, keep the flexible learning optional and give the parents the option to do the best for their kids. Thank you so much.
And I can say that the legislation from the state does provide for a distance learning option for kids who are at risk with health concerns. So there's no question about that.
Thank you. Next up is Kristen Kuramoto.
Hi, can you hear me?
Yes.
Great. I'm speaking as a parent of a third grader at Cumberland and a TKer at Vargas last year. First, I want to say, like a previous speaker, I do want to urge you to do extra outreach to those families that might not have the technology access to either complete the survey or join these Zoom forums. I don't know how to do that, but I do hope those families have a voice. First, I want to commend all the teachers and staff for all their hard work. And I am supportive of distance learning in the fall. There are two particular things that I want to highlight from our experience of learning at home in the spring. One is that doing school at home felt inefficient, and I definitely appreciated the structure of, you know, in-person schooling. For my third grader in particular, our day felt saturated in terms of hours of work and, you know, how much I could motivate him to actually do things. But the quantity of work that was completed was less. And I think having clear expectations, having high standards could help. For my child in particular, he was very motivated to do the must-dos, and all the can-dos were kind of, you know, not so much. So related to that, I could see that they were learning new things, but I had difficulty assessing them. And, you know, the end of the year report card, which, you know, I understand was not, you know, it wasn't grades. It didn't tell me anything new that I didn't observe myself. So I definitely have a newfound appreciation for all the work that teachers do, not only to teach, but to assess kids, and then determine appropriate next steps for their learning. If we're in a distance learning environment, I don't know exactly how to improve that, but I just want to highlight that as a concern, and would like to see more support of, you know, how can we, if we're in a distance learning environment, if we choose a distance learning environment, how do we make sure that the kids in that environment are meeting the standards, are learning the appropriate amount of grade work? Thank you.
Thank you, Kristen. Next up is Selena Y.
Hi. Okay, so I just had a couple comments. One is, as some of you may have already known, that there has already been a daycare in Sunnyvale that has had to close due to COVID in the staff and the children, and that you know, in the news we've seen more and more children are getting sick from COVID every day, and in some areas of the country, more than half those diagnosed are young people now. So I am wondering if the state or county guidelines do not, you know, mandate or require a full distance learning option for families who are uncomfortable with sending their kids back to school, but their kids themselves may not have an underlying condition. Will the school district still consider and offer one anyway, regardless of what the mandate is or whether it's required by the county or the state? We teach our kids to, you know, do better than the bare minimum, and so I'm asking if the district will do the same.
Lena, that's a good question. We'll offer it if it's allowable. So it's not a matter of, you know, is there a legal way for us to offer that, then that's our intent.
Next up is Gaiti Sahir.
Sorry about that. Can you hear me?
Yes.
I have a incoming fourth grader in a special day class at Bishop, a seventh grader at Columbia, and incoming freshman at Fremont. So I just had a question if there's any viable, safe options to send the special needs students back, because my son, I mean, he needs help walking safely to his classroom, washing his hands, using the restroom. He would not be able to wear a mask probably for more than a minute. I just don't see a safe way that he could possibly return in the fall at all. And I had a question about the middle schooler and high schooler as well. How would they disinfect the classrooms in the few minutes they have between periods, and what that would look like even if it was hybrid days? Those were the questions I had.
I know we have limited time, but just to give you a little bit of input, like always, we definitely will be considering the individual needs of each student. And so students who we recognize may not be able to follow potential protocols that we need to have in place, we will address each of those cases individually as we typically do.
And I am actually going to pass the baton to Mr. Nishihara, please, while I run to help set up the next meeting. Thank you, Jeremy.
Mike, are we going to hear more about middle school next time, like next week, or are we going to hear about the middle school at another time?
Yes,
That seems like it's a little more.
it's more complicated.
Yeah.
It's very challenging.
So she was asking how that's going to happen. So do you have a plan for when you're sharing thoughts on middle school yet, or?
So that'll come after we have the guidelines.
Okay, our next speaker is Deepali Suri.
Hi, can you hear me?
We can.
Perfect. Well, first of all, thanks to all the members here for doing an incredible job. I would not want to be in your shoes, so I really commend you for doing what you're doing. But thanks a lot. We highly appreciate it. I guess I'm kind of sharing the same concerns as others, and then I have one quick question about, the safety of the community at large. I think what we are addressing here are two problems. One is the education of our kids, which is a very, very important topic. But I think nothing can surpass life, right? I mean, nothing can be more important than life and health. And I'm sure everyone will agree that if you put two things into perspective, life wins over anything else. So I would absolutely want, the school district to provide an option to families. There are varied sorts of, logistical issues every family has, not just kids and adults with any pre-existing conditions, but a family like mine, for example, who has a 2-year-old with no support as such in childcare, all extended family, parents, etc., in another country. So my biggest worry, for example, as a parent, is if my child brings any infection from the school, especially COVID, me as a parent is not able to then take care of my 2-year-old, so I'm in a very tough spot at that time, whether I have a pre-existing condition or not. So I think bare minimum an option has to be given. And second is when we also think about at school programs, whether a cohort of 10 or 15, I think one of the key things to keep in mind is, even kids who opt to go to school or families who opt to go, it's very hard to explain on a daily basis to these kids what social distancing could mean. The whole idea of getting together is be able to communicate with your friends closely. If they're always, and I don't even know how for elementary graders, like being 6 feet apart is going to work out all the time, whether it's 10 of them or 12 of them. I mean, my house is very close to the Cumberland Park, and whenever I take my 2-year-old to the park, I mean, it's hard to explain to any kid who is biking there or running and with their soccer ball what 6 feet means, So every time reminding a set of 10 or 12 kids in the class, stay 3 feet apart, stay 6 feet apart, is only going to create more panic and come in the way of learning. So kind of defeats the purpose of getting them together all the time. So just keeping that in mind, some good protocol to follow in advance. But I guess the least I have to say is that please option be given to families in general of keeping kids at home. I know it's suboptimal with all the other issues other parents discussed, but at this time, if we have to choose between a bigger option and a smaller, we choose life over anything else.
Thank you. Our next speaker is Sylvia.
Hello, I have a quick question. Once the school year begins and the parents aren't given the option to continue distance learning, and the only option is in-person schooling, I would like to know, is there an individual independent study through the school, Sunnyvale School District? Is there an option to pull your kid and basically have file a petition for individual independent study? So it's not homeschooling, it's not connected to any of the schools. It's just a safer option for me to continue teaching my child. It's legal and I don't have to send them in the middle school or in the elementary school, because I have already lost a parent 2 months ago I don't want to lose a child. I don't want to lose somebody else, a loved one. And if we don't have the option for distance learning, how any of you are you gonna bear that a parent lost a child or a loved one because you made the wrong decision?
Yeah,
That's
so
why I'm asking, is there an individual independent study option for
that's
us to
when
do?
we refer to distance learning option. That's what we're talking exactly about, Sylvia. That's what we want to be able to provide for families, just like you're describing it.
Thank you, Sylvia. Our next speaker is MC Player Frameland 5220.
That's definitely the best handle of the night.
That is correct.
Oh, hello?
Hello.
Hi, sorry. It's Allison Joe. I guess I didn't sign in.
We prefer MC Player.
This is Allison Joe, a parent from San Miguel.
Okay.
Thanks for fitting me in. Some of my points have already been brought up, but I'll just go over them briefly. One was the lack of immersion in the Spanish immersion option with the distance learning, and how in non-Spanish speaking families, that's a real lack for the Spanish immersion. And thank you for keeping that in consideration moving forward. And then just the crisis or distance learning of the spring was incredibly stressful, even for a family with two highly educated parents with relative tech familiarity. And I can't even imagine how that went for families who are less, have less resources and tech availability and access. You know, I also wanted to add, so I work in healthcare, and so for me, my comfort level is different, but I wanted to appreciate what Katie said previously about the trade-offs between the risks and the benefits. You know, like there's probably not a way to reduce all risk down to zero, but also weighing all the benefits and developmentally appropriate needs for children. And just that I appreciate the importance of risk mitigation. I mean, I go into patient rooms all the time. I'm not working with COVID patients, but we use our PPE and it does what it's supposed to do. And there's ways to reduce that risk, whether the kids spend most of their time having outdoor spaces or wearing their masks or having hand sanitizer in a lot of places and a lot of use of it and a lot of disinfectant and the distancing. And if they could, you know, go outside with clipboards and do a portion of their work, you know, just sitting on the grass or sitting on benches or somewhere outdoors to minimize that risk. And I realize that that equation for risk and benefit is totally different for every family and every household. But it seems like there's so many benefits if we can reduce the risk to them being in person and present at school. With as many risk mitigation factors in place. And then I just wanted to question a little more about the survey that was presented at the last meeting. It did seem like it was skewed heavily. It had a large percentage of people who were not concerned about food and housing and finances. I don't remember the details specifically, but what's being done to try to capture the voices of a lot of those families who may not be replying to the survey or have had the tech access or English speaking to be able to be heard and have their needs met.
I'll just comment briefly because I know we have additional people who want to speak, but for voices that were not captured on a direct survey as a part of the portal, if you will, we have reached out to some families. Also, the way we're looking at the survey is not like an absolute. It's to give us a sense of what are some potential challenges that may exist that we haven't thought about. So in doing that, we're expanding our arms. Well, you know, if it's one person who made that comment, the odds are from a survey standpoint, there's probably some other individuals who feel that exact same way. So we are expanding the voice to not just the one or two comments that we potentially have received, but beyond, and also some conversations we're having that weren't directly as a part of the survey when it was administered.
Our next speaker is Lisa.
Yes, I just wanted to say that our crisis learning or distance learning was amazing. My kids go to Lakewood Tech, and we had Mr. Ha and Ms. Smith, and they had a good amount of work to do every day. Their expectations were very clear. They had no problem completing their work that they needed done, but I think a lot of that was because they had the prior relationship with the teacher. They already knew what to expect and how the classroom was run and how their work was supposed to be done, and they weren't afraid to ask questions. You know, they had that relationship, which is, I think, was a big reason why the distance learning was so successful, was because of that prior relationship and prior expectations. So I'm a little concerned that when they have a new teacher, it's not going to be, you know, quite as easy for them to speak up or for the teacher to know what they understand or their personality. I mean, I don't even know how you would deal with that. But that's one of my concerns, is that without the clear expectations and prior relationship, a distance learning wouldn't be as effective. Also, like other people had said, I was concerned about the Spanish-speaking families, how they're getting this information, you know, the people that are essential workers, the people without tech, because I know a lot of our school, it's not, you know, just English speakers, you know, who have parents at home, you know, to help their kids. And so I think, you know, they may have different needs than a lot of us that are speaking out, a lot of us that have the technology and the time to go ahead and, you know, talk to you guys and reach out and complete surveys and make our voices known. They may not feel, you know, able to speak out. They may not even know this meeting's going on. They may be at the grocery store working right now, or they may be in a restaurant working. So I just want to make sure that those families and their needs are considered as important as ours are, that can make a lot of noise. So that was one of my main things, is just to reach out to those families and make sure that they are getting what they need. Because honestly, the rest of us will be okay with whatever you decide, basically. I mean, you know, it may not be what everybody wants. It may not be the perfect solution for everyone, but most of us are going to be able to make it work like we did last semester.
Thank you, Lisa. Mike, we have 3 other speakers. Do you want to just power through? It is 7:02. You are muted.
Yes, let's finish up these last 3. That'd be great.
Excellent. Thank you, panelists. Here we go. SV, you are our next speaker.
Hi, thank you for holding these Zoom calls. I think we all appreciate that. I have a very quick question. Since distance learning seems to be, is going to be probably a big part of the learning plan in the fall, has the district considered hiring or partnering with any distance learning experts that have done this for years? I mean, I think there are schools that have done that, or there must be experts that have done that for some time. That's my question. Thank you.
Mal, I don't know if you want to just answer that quickly.
I can just share. So we are, we have someone in our department who works with technology integration, you know, in instruction. And we also work with the County Office of Education that has an IT team, and they're supporting us a lot in the professional development. So that's the collaboration that we're currently using to provide the support.
Thank you, Mala. Our second to last speaker is Laura. Laura, go ahead.
Hi there. I just wanted to share my experience, and this is actually Rosa, Laura's sister. So I have an incoming 6th grader and an incoming 8th grader to Sunnyvale Middle School. And I wanted to just let you guys know that it's been a really hard struggle for me, because I have a daughter that has learning differences and she has an IEP. So it's been a really struggle for me to help her at home, since I'm working full-time and so is my husband. And I understand everybody else's concern about COVID and the safety precautions and protocols in place. But I think she's regressed. She wasn't able to focus, pay attention, advocate for herself. So it's been a really hard time for us, and also very overwhelming. And I also have a typical daughter that her experience was a little bit different. So she was able to, engage and some learning went on, but not for my other daughter. And I just really wanted to let you guys know that some kiddos are okay with distance learning and they'll learn and they'll be okay, but kiddos with special education IEPs, I think not. I think they need the in-person, and I think they need, if they're not able to provide the in-person, then the one-on-one support definitely needs to happen so that they don't regress further. Thank you.
Thank you, Rosa. Our last speaker tonight will be IC.
Yeah, hi, good evening. So my name is Ioana, and I have 2 daughters, but just one of them is a 7th grader at Sunnyvale Middle School. And I very much appreciate that this is an extremely complex problem to solve and try to accommodate everybody's preferences into the system. However, I have three areas where I'd like to understand a little bit better your thinking, your challenging, and maybe what are you doing in terms of resorting to parents as a support community, while some of us, may be overwhelmed with, many jobs that we do. Some other us, we traditionally help volunteer and put together programs, and some of us are really skilled in IT and so on. So one aspect of the problem is children. I really hope that there will be an effort that would help some mix of an in-person with remote learning. And there I'm curious about 2 things. One, I found it personally, I found it disappointed that the system was not able to move compared to other schools and other teachers I know across the countries and other schools across the country to literally an 8 o'clock to 3 p.m. online equivalent education. So having children watch videos and only checking in once a week with the teacher, I really think it's lowering the bar way too much. So is it possible maybe to think, or are you thinking along the lines of splitting it in groups and those who have access to education to continue, and then as the other ones have access to technology to add them and bring them to the same level? What are you doing in terms of the sanitization at school? Are you looking at putting maybe plastic panels around the individual benches where kids sit, or along those lines? 3, about teachers. I can definitely empathize with, maybe some of them are not versed with technology. What is the district doing in terms of educating and training teachers and making sure that the teachers have the right support and the resources? And the other one is, again, how do you reach out to parents who really want to help volunteer in any shape or form that we could do?
So thank you for that. You asked a number of questions, and I'll kind of answer that the way Tasha answered another parent who had a number of questions in that. I think all the topics that you're bringing up are ones that we're considering and working to address as best we can moving forward. I want to thank everyone who shared their perspectives today. What's super impressive to me is that, well, first of all, everyone focused on, I said at the beginning, we have kind of 4 principles that we're paying attention to, and they are safety, equity, flexibility, and high quality instruction. And it seemed like all of the comments fell into those categories. And the part where I'm super proud to be part of Sunnyvale is all the people who voiced concern for the people who maybe don't have the means or the opportunity to share their voices. There were, at least a half dozen to 10 or 12 parents who were concerned about others, which really I think is a defining quality of the Sunnyvale community, which is just really, really neat. So Okay, we've heard, you have the district leadership team here, 2 of our school board members. We've heard your concerns and your questions, and we don't have all the answers yet, but we'll be working on them as we go through the summer. As we mentioned at the beginning, there'll be another of these forums, 7:00 p.m. on Wednesday evening. That's the next opportunity for input. And then there's also going to be a Board of Education meeting at 7 p.m. on July 8th, where we'll be presenting some options to the Board of Education for moving forward. So a lot is going to happen in the next couple of weeks where we start to define our plans. Again, I really, really appreciate everyone's input. I don't know if Bridget and or Reed, you want to say something? You don't have to, but just in closing, I'll give the floor to you two.
I just want to say thank you all so much for taking the time out today to be with us and share your stories. It's really always interesting to hear the different perspectives, and certainly it's going to be really difficult no matter what we do. And I hope that we can make everybody happy. I hope that we can have options that will satisfy everybody, because that's really what our goal is. We don't want to force anyone to go to school if you're uncomfortable, scared. I mean, there's so many reasons. I understand that. And we really want to get kids back in school for those of you who are comfortable with it, because we feel like that's where they're really going to get the best education is in person and the social emotional learning. So I just want to thank you all. Apologize again for the other night. And I'm really happy we had a huge turnout tonight. About 200 people participated. So we definitely needed this time. And we're offering another time on Wednesday so that we might get a bunch more people, which just illustrates how important it is that we have these conversations, and we will do the best we can. It's not going to be perfect, but we will work so hard to make it as good as we can do it. And we're using resources of other districts. We're using resources of the county, of the state. We're doing everything we can to understand all the issues and hear from you, and we'll see what we come up with, and we'll do the best we can. So thank you all so much.
Yeah, and I just wanted to add on to what Reed said. I agree with everything Reed said, but I also just want to say that, you know, it's really important that however we reopen, everybody of course wants their kids back in school, but I don't know that it's at the risk of everything. You know, I think that it's super important to really just make sure that whatever the back in school looks like, you know, back in school maybe not in person, or if we do go back in person, it has to be as safe as possible. I mean, it just has. I understand that there's always some risk, but we have to do everything we possibly can to mitigate the risks, even if when we have to go above and beyond. So I'm very, very empathetic and very sympathetic with the precaution that's needed, and just the amount of trust that everyone's putting in us as a group. It's just it's phenomenal, and it's frightening. So we absolutely will do the best we can.
Thanks, Bridget. And thank you everyone again. And thanks to the panelists, the staff for being here. And we'll see you all, if you want to, on Wednesday night at 7. Thank you.
Thank you all. Bye-bye.